So let's go over the adolescent and particular health promotion and growth and development about the adolescent. So major health concerns, school performance obviously becomes much more important at this stage of the game. Sexual issues, sexuality, sexual health, all becomes very prominent in our list of concerns. Body image issues, and just the developmental need for adolescents to become more independent and separate from adults, or from their parents, excuse me. So growth and development, they have a huge growth spurt during puberty. Generally, as we said, girls around the age of 9 to 10, boys about 2 years later. And we will continue to plot, as we will with all age brackets, on our growth curves to determine where we're at, that we're growing properly, we're not showing significant loss or gain, and our BMIs are within good ranges. Developmental tasks is really basically just separating from the family and developing relationships with their peers, both same-sex peers and opposite-sex peers. Nutrition-wise, one of the big overarching concerns we have is that this is now a very social age bracket, and so many of these young adolescents have a lot of activities, are out with friends a lot, tend to have a lot of high-fat foods, fast foods, and not as much money as they'd probably like to have in their pocket, and therefore most of the foods they can afford to buy are usually foods that are not as healthy for them. So we do need to continue to follow this age bracket closely and really talk about options for them that would be more healthy around that busy lifestyle. So nutrition wise, some things we need to remember: 5 fruits and veggies a day. That continues from preschool age on. Whole grains, 3 meals, some snacks. And we do find difficulty with that sometimes because, of course, in today's world, as we all know, we are bombarded with dieting rules, or there's a new diet we can try, and now intermittent fasting is becoming a lot of interest for a lot of people that have a lot of questions as well about them. So we really have to make sure we have our finger on the pulse of these adolescents, because they're hearing it all and there's a great deal of confusion, and again, they need to have the correct information. We do like to encourage family mealtime at least once a week with the adolescent population. That can be a challenge, but while their peers are the most important people for them, parents haven't left their circle of at least importance. Eating disorders really take on an upswing here because of body image issues, and we are screening constantly for that. The majority of young people who do have eating disorders do fall into that bracket of adolescents. Physical activity, we have talked about this. Only 36% of teens report daily vigorous activity, and only 22% of 12th graders regularly attend gym class. We talked today in class about the fact that gym class is being cut in most districts in order to save money. And that recommendation of 60 minutes a day of moderate to vigorous exercise continues. So we're sort of giving a mixed message to our young adults and young adolescents, and we really need to remember the importance of physical activity, especially those young adolescents and older adolescents who do not get involved in sports of any kind. They are even more of a risk unless we can get them doing something physical. So we can teach them various different ways to do this. This is obvious. I don't need to read through this slide. You know, there are multiple ways that we can get people to exercise, and finding out what an adolescent enjoys doing certainly is going to give us greater success with activity. Mental and spiritual health, there are great challenges in the teen years. You all have left those a couple years ago, so you're probably still fresh in your brains. Self-esteem becomes a key component that young adolescents are working on, and we want them to understand that there are many things that they do that we're proud of, and we want to know what are they proud of and what do they want to work on. It's important for adolescents to understand that. Mental health disorders develop during these years, and we do need to assess suicidal thoughts, anxiety, depression, and really assess and keep checking in with our adolescents about those factors. And many of those relate back to that self-esteem concept. Sexual health is a big overarching topic that we deal with in the adolescent population. I mentioned this earlier in class that while sexuality does involve body changes, the mental concept of oneself as a sexual being. However, those two things do not necessarily mature at the same time. So while I may have the physical changes related to puberty, I may not have the mental capacity to know what to do with them. Decisions about sexual behavior are not necessarily linked to your sexual maturation, and that is really important to pay attention to. We worry that people will assess or have expectations of young people who have entered puberty, maybe on the earlier end of that curve, but do not have the sexual maturation mentally about all of that. And expectations can be very difficult and confusing and can really lead to some difficult situations and some potential dysfunctional relationships or unhealthy relationships. It is important. Use the correct words and ask directly. Ask teens, have you had sexual intercourse? Not just sex, because that is defined differently. If the child says, I've had sex, or the adolescent says, I've had sex, ask them to define it. We need to know what their behaviors are so that we can provide the proper information for them. It is important to allow them to ask questions in the absence of a parent or caregiver and provide them with supports, understanding that we will not discuss anything that we are discussing with them unless we are concerned about their safety with anybody other than them. So we won't go to the parent unless we feel their safety is at risk. Adolescents and parents, while we're talking about that, they are trying to gain independence. They still need guidance and reassurance from parents, and that can sometimes set up some really difficult situations in terms of conflicts and, arguments and disagreements that can really become very difficult for both the adolescent and the parent, and we need to talk about that. So some communication strategies we can talk to the parents about is helping them understand that the adolescent is trying to become independent, and they need to do that to be a functioning adult in today's world. We need to reassure the adolescent that the parent is trying to help them. They're not trying to make their lives miserable or to keep them from doing anything. They really are trying to provide them with the best guidance they know how to help them grow and develop into healthy, functioning, independent adults. And we need to encourage parents to always reward, catch your adolescent, and this goes with all age brackets, catch them doing good things and reinforce them, tell them you're proud of them, tell them they've done amazing work, so that when you do come to them with something that needs to be addressed, it becomes a little more credible, as opposed to all I hear is what I did wrong, and I need to hear what I do right. So some disease prevention, again, this seems pretty obvious. Depression, anxiety, stress management, smoking, alcohol. We may begin testicular and breast exams depending on level of development. And then, of course, we do need to check immunization status because as these adolescents head off to college, we do have immunizations that we need to ensure that they have had, as well as your yearly flu. Blood pressure is now being done. We will check for STIs if the adolescent has indicated that they are in a sexual relationship. So we do adjust our screening based on what history that the young adolescent is presenting. Blood pressure is followed very closely here. Certainly BMIs are followed very closely. Urinalysis, not uncommon to have UTIs, especially in females at this age. We do want to talk to them about skin cancer. This is an age bracket that tends to spend a lot of time out in the sun, baking to get that awesome tan. And we really need to talk about sunscreen use and the use of tanning beds. Injuries-wise, as you all know, drinking, drugs, driving, the 3 Ds are things that we absolutely need to pay attention to in this particular age bracket. We also need to talk about the use of phone and texting while driving, being with friends while driving, distractions. And then additionally, sports injuries do go up at this age bracket because they are competing in much more organized sports. And we also do need to talk about abuse. And in particular here, relationship violence. We need to start to use the terms and really ask and talk to adolescents about relationship violence and proper, healthy relationships.